Well, first and foremost, thank you for being here. Second, I'm just surprised how many people have foam rollers, so that's awesome. I did structure this sort of into two different parts. The latter part is more focused on foam rolling for specific body areas. So if I miss any areas that you would want to go over, feel free to bring that up. I just tried to make this as important and as salient to what I would expect you guys are going over in your day-to-day. So the first thing I am going to just quickly talk about is me. I work with Amar. He is the owner of EverStrong. So if you guys have any particular questions, if it starts to get a little bit too detailed where I can't just give you a quick answer, I'd be more than happy to have you guys consult us and see if we can help you in any way, shape, or form with your movement. Cool. A little bit about myself. I am the boyfriend of this lovely instructor here. I've heard good things about her from all you guys as well. Alrighty, so mobility and flexibility here. So this is a pretty important concept. When I talk about flexibility, that just equates to how much a muscle can change its length. So for example, if I take my bicep as it attaches right here and up here in my shoulder, if I have a shortened or stiff bicep, my arm won't be able to move out. So that's a lack of flexibility. That's how much that muscle can change length. Whereas mobility equates to how well the joint itself can move, how well I can control that movement. So flexibility can be a limiting factor of mobility, but very rarely is it the only factor that is limiting mobility. So flexibility, and then we can also talk about, it's coming in here. So flexibility, and then we can talk about capsular mobility. So essentially how well the soft tissues around the joint are able to stretch and deform to get to full length of that. And then on top of that, we have the input of the nervous system. Does our brain sense that it's okay for us to move through this entire motion? So what foam rolling does is primarily works on flexibility as it relates to sort of the smashing, the rolling that we normally do. That can work to increase muscular flexibility, like I said. Two other aspects that it helps us with is reducing DOMS, or delayed onset muscle soreness. So there's a couple studies showing that individuals who did and didn't on self-reported measures of muscle soreness, those who foam rolled versus those who didn't with the same amount of load applied had less soreness. The third thing that can work from foam rolling is stimulating the autonomic rest and relax nervous system. That can potentially put us at a little bit more of a relaxed state, get a little bit more motion that way. And then the way in which it works, I don't want to lose you guys with these sort of medical fancy jargony words. First idea is that it adds heat to that muscle. It's called trixipy. Essentially, if I take a massage gun and I hit the same spot on my muscle here, there's going to be more warmth there. That more warmth will allow those muscle fibers, as they're sort of cross-oriented, to stretch and become more extensible, flexibility. The second idea is it stimulates receptors within the muscle, pressure receptors, that will eventually allow the muscle to stretch a little bit more. And then the last idea is it breaks up any kind of fascial adhesions, those protein structures within the muscle. So what I did in this next section, which is the foam rolling, is I put a couple of tests into this here, where if we potentially ourselves find that any of these tests are remarkable, these would be the specific areas that we could target with foam rolling. I will say I only did like about 5 or 6 of these, because I wanted to leave a decent amount of time if there was any specific areas you guys had questions on, or specific muscle groups that you had for foam rolling itself. So the first one I'm going to sort of show us is the hip flexors, the quads here. I will have either Rachel or Amar help me out. Yeah, no, one at a time here. Well, come on up. So we're going to talk about a couple of tests that I would use clinically, and then I'll try and give you guys a couple ideas how you could either recreate these at home or potentially ways that you could go after the foam rolling. So come on over here. What we're going to do is a Thomas test. what I'm gonna have her do is essentially grab her leg, and then I'm gonna have her fall onto her back.
Is it all the way up?
Yeah, just right there with your back, and then you can grab your right leg. So what we're gonna look at is her left leg as she comes back down. And you can go ahead and let that relax. So this is just a quick way to see, does she have any tension in her quadricep? So for you guys outside of here, it's something you could probably do at like the edge of your bed, and then you could take a video or potentially have a significant other look at you. What you're looking at is how much bend is in her leg here. So at rest, she's not quite at that 90 mark that I would see if someone had no flexibility issue. Whereas here, you can start to feel a little bit of a stretch in the front of your thigh. Cool. So it tells me that, yeah, she would be a good individual to work that outer quad muscle there. The second thing that I will commonly see on this test is individuals who come up like so. That is not necessarily more of the quadricep, the rectus femoris muscle, but more of those hip flexors up here, the iliopsoas complex. So knowing that, more hip flexor here, this comes out more quadricep. That can sort of hint you at what muscle groups you might need to mobilize. The last thing I will commonly see is the leg, if someone has a very tight IT band or muscles that attach to that IT band, the leg will start to come out to the side there. So that's when potentially you would have more improvement working through your TFL muscle, your glute med, and then that lateral quadricep, as they all have contributions to that IT band. Cool. So come on back up. So it's pretty darn simple to go through, and this is where we'll actually get to the foam rolling, guys, where we can go through a little bit of our quads. Just structurally speaking, quad means four. We have four quadriceps. We have what's called our vastus lateralis, or our most lateral quad muscle. We have our VMO, or vastus medialis, our medial quad muscle, and then two right here, vastus intermedius and rectus femoris. Those are our two right in the middle quad muscles. So what I'll go after is first the vastus lateralis. The way that I like to go after this guy is get yourself on your forearm here. You're gonna bring 1 foot over, and then you're gonna slightly tilt yourself down towards the ground. We are working from roughly this area here to about this area here. And this entire area there is our lateral quad. And there's a couple cool tricks we can do with this guy. If we find maybe like a pretty tender area, what we can do is we can slightly bend our leg, and that's just a way that we can add a little bit more pressure. So be a little bit light on that one. It can be a little tender if we do have a little bit of tension in that muscle. So what I would recommend first is just nice and easy, slow and controlled, going back the entire back and forth the entire length of that muscle. And then if we do potentially find an area that's a little bit more tender, we can pause on that. We can just go back and forth, do a little bit of a seesawing motion. And then if we do want to add that extra little bit of pressure, we can either take more weight out of our leg, our hand, or we can add that little bit of tack and stretch, pin and stretch motion there.
So if you're feeling pain, does that mean it's tight?
Yes. The other thing I will go after is if you get a little bit too far out on your side, you're going to get onto your IT band. So it's called your iliotibial band. It's just a big old sheet of connective tissue that runs from these muscles up here down to the outer portion of your leg. I will say this, if you've ever been told just to roll your IT band, it's not really an effective use of your time. It's more the muscles that attach to that IT band that you're going to have the most gain from. So,
Can you repeat that?
oh yeah, so IT band, it's non-contractile tissue. It's just a big old dense piece of tissue that you're not necessarily going to make the most. It's not a good use of your time if you're foam rolling on it, because that tissue doesn't change length. So if you just smash and smash and smash, it's probably not going to do anything, whereas if you go to the muscles that attach to that IT band that might be pulling it in that tense position, that's where you're going to have your most benefit. So we've gone after the lateral quad here. The next one we're going to do is we're going to roll onto our stomach. And we're thinking about going from the top of our knee all the way up to this bony projection. If you sort of feel the front of your hip, if I stand up, I'll show you guys what I'm talking about right here. This is what's called your ASIS. It's the front part of your pelvis where one of your quad muscles comes and attaches. So right below that, all the way down to the top of this guy right here, our patella bone. That's where that intermediate and then more deep intermediate 2 quadricep muscles are. So from here to here is where we're focusing here. And again, it's the same idea. Start by going through the entire muscle. And then if you do find a spot that potentially is a little bit more tender, you can stop there and add a little bit of that pin and stretch motion.
So do you recommend doing it like daily?
Yeah, so what I would say is, like I said, foam rolling is generally, at least foam rolling to muscles is generally meant to improve flexibility and tissue extensibility, how well that tissue can stretch. So I would say do this as a little bit more of a warm-up. The reason being is if we get these tissues at appropriate lengths where we can then move through that motion, the brain hopefully hits the save button on that, and then we will have that extensibility, that flexibility that won't limit the mobility next time we try and do these things. Also, if we're looking to limit the delayed onset muscle soreness, after is when we can go after these guys. Not the same day of that potentially heavy resistance workout, but the next day after, that's when we might find a little bit more benefit going after this in terms of reducing that overall muscle soreness.
Oh, not the same day.
Yeah, you can, but days after, it's just shown to sort of speed that process up. Cool. So the last of the quads is our vastus medialis obliquus. It's our medial quad muscle right here. So you can sort of see mine right there. It comes up this way. This is sort of a tricky one to get to. If individuals have just a regular gym membership, one thing that I'll like to do that isn't foam rolling is take a barbell, and then you can just lightly come back and forth over that muscle. For us with the foam rollers, what we can do is come here where it's a little bit more out towards our side and angled, and then we can just come back and forth over that muscle like so. And again, the same principle, adding that sort of pin and stretch if we find a potentially tender spot.
Would you show it with the barbell too?
Yeah, I can. I don't have a barbell with me though. So let's pretend this guy is a barbell.
So we don't have, I was thinking of just the weight, or what's different.
Yeah, so you can take,
You're thinking of a dumbbell.
Sorry, never mind.
no, it's totally fine. The idea is any kind of compression onto that tissue, whether it's with a hand weight, whether it's with a barbell, that pressure is what we're looking for. So let's say like this is a barbell. What you can do is you can just take that, roll it back and forth, where if it is a ton of pressure, you can sort of use that grip on the bar to pull up on it. Because again, this is a little bit more of a tender spot to work at. Yeah, what's up?
On the previous one, you talked about the range of motion from the top of the knee to the top of the hip.
Uh-huh.
But I don't seem to be able to do that without walking my hands.
Yeah, show me what we're talking about. I'm trying to.
Range or like you said, to get the full range of motion, that would be from here all the way down to here.
Uh-huh. Yeah, so look at your back foot. Look at your back foot. What you can do is you can stagger this foam roller so it makes it a little bit easier. And you see how I'm essentially just bending at this other hip?
Right.
That's going to be a little bit easier for to go after.
You're not getting above your hip because you pointed way up.
Yeah, so the tendon, again, just like that IT band, it's the piece of tissue that we're not going to change length. So the tendon is right about here. We're going to go from here to about there. Yeah.
Okay.
Yeah, sorry if I wasn't clear on that.
No, you and everyone else that's ever told me this. I just misunderstood that. I thought I was supposed to be going. So every time I've ever tried to do this, I'm like,
Yeah, so just to be clear so everyone knows this, your quadriceps, there's only one of them. So 4 quadriceps, only one of them crosses your hip joint. It comes all the way up to here. Your main bulk of that quadricep muscle, those 4 quadriceps, is going to be right there. So this is like the hot spot that you can work at. There's just a little bit more that you could get to up here as well, though. Cool.
You say to do this after working out is optimal?
Yeah, so what I would say is before, it's just gonna allow you, so like let's say I don't do any foam rolling to my bicep here, and I can't get my arm all the way out, and my plan today is to do bicep curls. If I foam roll, if I do soft tissue work to my bicep, that's gonna allow me more motion before my workouts. So it's something that you can utilize to improve that flexibility. And then after workouts, significantly that day after, if we're feeling a little bit sore, it's just something that can accelerate that DOMS, accelerate that recovery, so to speak, so you're not as sore. Cool. Any other questions on the quadricep specific foam rolling stuff? Cool. Alrighty, so the, yeah, a minute or two per muscle. You're gonna, like, the coolest way that I'll do it is like, I'll do like a test retest on myself. So for the quads in particular, I'll do what's called like a couch stretch, where I'll get like a box or potentially even take my hand and bring it up here. And I'll get into this position, I'll say like, just touching base with myself, like how does it feel in my quad? Then I'll go through it and then I'll do like a little bit of a recheck. But I generally speaking, spend about 30 seconds to a minute and a half per each muscle. It doesn't have to be like a specific amount, just as long as you're getting that 20, 30 seconds at least. Cool. Any other questions before we move on to the Ober's test? Cool. All right. Oh.
Is there like a too long amount of time to do it, where we do more harm than good?
I don't think there's any deleterious effects for doing too much foam rolling. I would just say if you are doing like an astronomically large amount of pressure, it's going to be hard with just body weight. That would be like the only possible thing I could think of in terms of like giving yourself a contusion or like a bruise. But besides that, not really any kind of ceiling. Yeah. Just going to be hanging out in the gym 20 hours doing foam rolling. Cool. Any other questions before we move on to the next deal? Cool. I'll have you come on up. So this will probably be like the only one that might just be a little bit more challenging to do yourself. I'll have you on your left side, facing that way. It is called the Ober's test. So this is to test the length of the IT band, which is a little bit misleading because like I told you, it's just a big old sheet of connective tissue that runs from about right here down to right here in our knee. So individuals, specifically runners who have a lot of lateral knee pain right here, if that band of tissue, the IT band, is a little bit too taut, that and easy go over that. Also able to access it with a foam roller. Just like so. It's very similar to what we were doing with the vastus lateralis roll with the setup. The only difference is you're just a little bit higher and outside with that hip. So again, right there. So that's our TFL, our glute med. We've already done the vastus lateralis, that outer quad muscle. The only other muscle that we would want to hit, if we do find that we have a little bit of tightness in our IT band, is that glute max muscle. This muscle runs from the top of our pelvis here. If we put our hands on our pelvis like so, we should feel like a little bit of a lining going around towards the back. That lining, if we jump over the edge, that's where that muscle starts, comes all the way down towards our sacrum, and then comes in, attaches right here on our hip. So this is the area we're looking at right there. I don't think I've ever had that many people staring at my butt before. So the easiest way to go after that, since this muscle is what's called an external rotator, it helps to bring our leg out, is to actually put our foot into that position, use this bottom foot here, this hand here to offload ourselves, and then we're just coming back and forth.
So how are you avoiding that area you said to the
Yeah, so this greater trochanter, like I said, of the femur, that's a little bit more lateral. So that's right here.
Are you on the side where
Yeah, so you see where my fingers are at? that's where that greater trochanter is. If I come over to the side here, that's when I'm hitting it. And you're gonna feel it. It's gonna feel very, very obvious that you're working over a bone and not a muscle. Whereas if you tilt yourself back, you should feel that same kind of like massage sensation over the muscle here. Does that make sense?
No.
Okay.
I do my butt a lot, and I never knew that I was supposed to watch out for the...
Is it okay if I touch your hip?
Yeah.
So stand up real quick.
Stand up or-
No, you're good right there. So you can feel that bone.
Yep.
Okay, so that is your greater trochanter.
Okay.
Around there, like I said, there's a couple sensitive structures that you just wouldn't want to be smashing in.
Yeah.
Back here that's more of your glute max.
But
That-
where's the one that had, I thought it was back here, you're saying that had the,
Right
it's there.
Yeah,
Oh, okay.
right there.
My bad, I totally got it.
No.
Okay.
Cool. So those are all of the main muscles that attach to the IT band. Like I said, not the best use of your time if you're just going through the IT band, more so with the muscles. Understanding those are the contractile tissues, not the darn IT band. Something I get told a ton.
The last muscle that you just went over, is that what contributes to not being able to cross your legs on one side?
We're actually gonna get right to that one.
Oh, I thought you were done, sorry.
No, I'm probably gonna run out of time with you guys, so I apologize if I didn't skip through all of the nutrition stuff. You've got,
A good solid 10 minutes.
cool.
For sure.
We'll get through as much as we can, but essentially it can be. We'll go through a couple muscles that would limit that motion. I don't want to get lost in the weeds here with a lot of this stuff, so let's just jump on up. I think that is our next one here. No, sorry, our next one is our hamstrings. If we're going to go into this position here, essentially what will limit us is either the hip joint itself or some of the muscles on the inside. This glute max, that's going to actually get stretched if we go the opposite way, so not necessarily, just like a quickest easy answer I can give you. The next thing we're going to do is look at our hamstring length. There's a couple different tests that we can do to look at this. And then I'll just have you lying on the back. So the first one is what's called a passive straight leg raise. I always like to point my patient's foot. The reason being is if they have any kind of sciatic nerve irritation, if you what's called dorsiflex or bring their foot up, that can add a lot of tension. So if I do this with her here, she probably feels like ow, and then if I take that away, it takes off the slack, it probably feels better, yeah. So just if you are doing this at home, make sure that you're not just tensioning the heck out of your nerves if they are a little bit irritated. For her, I'm just going to bring her up, and then she gets to about, if we make this into a degree with her hip, she gets into about 50 before I can start feeling a little tension. So potentially hamstring mobility or flexibility, I will say, might be one of the contributing factors with some of the things you have going on.
I talk about my hamstrings all the time. I know, not the hamstring stretch.
So that's the first way that we can look at that. Ideally, what we would look at is this hip joint having the capacity to get to about 70 to 80 degrees here. That would be like normal. The second way that we can look at it is what's called a 90-90 test. So you can just bring like a belt or your hands behind your knee here. And then you're just looking to extend your leg up. She gets to about right there. So she's roughly like 20, 30 degrees off. Ideally, we would get to, if her knee was still all the way up here, about 15 to 20. That's what normal hamstring length looks like. So hamstring is pretty darn easy to go after. You have three major hamstring muscles. You have one lateral hamstring muscle that comes right about there, all the way up into what's called our ischial tuberosity. If you sort of poke yourself in the backside, you're going to be able to feel like a little bit of a bump there. That's where all of those hamstrings come and attach. Again, you have that outer lateral hamstring, your bicep femoris, and then you have two inner hamstrings. You have your semimembranosus and tendinosus starting from the inner portion of your leg here, coming up again to that ischial tuberosity there. The way that you can foam roll these guys, if you do potentially see, I've got a little bit of limitation to my flexibility, is by biasing your foot out and in slightly. So this is going to be one where you're all the way on your backside. Again, using this bottom foot and your hands here to offload your weight as you need. And then if we're going to hit the more lateral or outer hamstring, what we can do is we can rotate our foot slightly out and away from us. And then you're just coming all the way back and forth. Whereas if we want to work a little bit more of the inner or medial hamstring, you're just going to point your foot in. And you should be able to feel the difference between those two hamstrings there coming on the inner portion relative to outer portion. Cool. Any questions on the hammies? So another thing that I like to do is if I do find like a very significantly tender spot, it works better with like a lacrosse ball. But you can set yourself at like the edge of a bench, and it's the same idea as that pin and stretch where we're going after the quads and bending the knee. You can bring yourself up like so, and then you're just gonna extend the leg out if you find that sort of hot spot. Cool. Any questions on the hammies? Cool. Okay. I'm going to skip the piriformis. I don't think we have time for it. And then we're going to just jump into the shoulder. I'll have you lying on the back for me if you don't mind. So we're going to look at a little bit of lat flexibility. A quick little screen that you guys can do outside of here is sit at a wall. If you have like a broomstick, you can do that first with your hands in towards each other. That's called internal rotation. And then you're going to see how far close to the wall can I get. You're going to come back down, and then you're going to do that with your hands out or externally rotated. If you see that you can significantly get less with your arm, gosh, I got to think about this now, internally rotated. Okay, yeah, out externally rotated. If you notice you can get much less here, that might be a sign of latissimus dorsi inflexibility, so our lat muscle here. So if I test that with Rachel, I'm gonna have you bring your knees up. The reason you're gonna want your knees to come up is because the attachment site where your lat attaches, it has a lot of fascial, sort of connective tissue connection with your back muscles. And if her knees are up, it just doesn't allow her back to round or potentially get that extra motion from her back. So I can come here, and you've got really good lat flexibility, darn it. So if I went there and I was like, oh man, I can't get her any farther, and it is lat that she feels a little bit of a stretch in. Potentially if you did this at home with significant other or by yourself, that would be a reason to go after lat flexibility, as I commonly find that this is a limiting factor, getting overhead positions full. Cool. So this is, I will not sugarcoat it, pretty tender for some. I will say if you go too far onto your back, you're just going to start rolling through your scapula. It's your wing bone on your back. So if you do feel like just a huge amount of bony pressure, what I would have you do is just roll slightly more onto your side rather than on your back. The easiest way to get after this is start actually a little bit higher. And then I like to start with my hand behind my head, totally up to you. And you can just come back and forth. We're looking to go from roughly our side body here all the way up under our armpit like so. So that is our lat. If you are not sure that you are on it, what you can do is you can reach up a little bit, and then you should feel a little bit of stretch under your armpit when you do that. So right there. And then we're just coming back and forth here. Frozen shoulder is commonly also called adhesive capsulitis. So around your shoulder joint, you have your capsule. It's essentially the soft tissue structures that hold your shoulder steady. It is a different set of connective tissue than your muscle. So not necessarily, no. It's more of the fibrous structure around your shoulder rather than the muscle. It's just saying that fibrous connective tissue there is limited, not your muscle. What I will say though is pretty much every single frozen shoulder patient I've worked with has limited overhead mobility. So if your arm has been down here for a really long time, then yeah, the lat will probably get a little bit tighter. Because it gets stretched when you go up and overhead like so. So if we've just been down here for a really long period of time, that muscle adaptively shortens. Cool. Cool. Any questions about any of that stuff there? Cool. Am I gonna run out of time if I keep going?
I'm just gonna go ask Cassie how she feels about just making her class start a few minutes late, maybe.
Okay, because I don't want to run into everyone else's time. Yeah. I've got like I've got a couple other ones that I really want to go after. But are there any areas that you guys would want me to like specifically address in case I am going to run out of time? Calves, yeah, easy peasy. So your calf, we'll just talk about a couple quick screens. The first one that I'll do for the deeper of the two calf muscles, your soleus, is to get someone up against a wall, hand, thumb. So if this water bottle here was the wall, I'd put my hand and my thumb. And what I would normally expect, given that there's no joint restrictions, that my knee should be able to hit that wall. If instead you can't get your knee to that wall and you're saying, holy camole, like it feels like a really, really good stretch in the back of my thigh, potentially your soleus or deeper calf muscle is potentially a little bit tighter or inflexible. The more superficial or gastrocnemius muscle can be stretched by coming here. Clinically, if you lie on your stomach real quick. Clinically, the way that I'll look at that with someone is I'll come up, scoot yourself back about 2 or 3 inches. I'll have them come up and I'll put their foot like so. And if I lengthen their foot and I start to feel their foot point down into my hand, it tells me not that deeper soleus muscle, but the outer gastrocnemius muscle, that's what's limited. So one way or another, you can come on back up. The easiest way to go after this guy is just like the hamstrings, both going outer and inner, because that outer gastrocnemius muscle, it has 2 muscle bellies, a lateral and a medial one. So when we go after this, we both want to go after it with our leg out, and then also with our toe and our leg in. Like so. So the area that we're working is all the way from the bottom of the knee, more gastroc here, gastroc, and then the soleus is the muscle that's a little bit harder to get to. It's a little bit deeper. If I find someone with like a very significant soleus restriction, I'll have them come into this position here. And then they can take like a massage ball, a cross ball, and then they can work through that specific muscle in this way here. Cool. I'm gonna try and like rapid fire these. Are there any other ones? Any other areas you guys specifically want me to talk about or address?
Do you have anything for the neck?
For the neck, this is where it gets tricky in the neck. Foam rolling, it's too darn broad. There's too many bony structures. I could probably do like a full workshop on like how to use a lacrosse ball for the neck. Yeah. I would say lacrosse ball would be better, especially for like the upper trapezius muscles. The other thing that I've had individuals use is like a lacrosse ball for like suboccipital muscles up here, like the deeper top muscles of the neck, but it's not anything that I would go through in a group scale because they're very small and a bit more difficult to get to. Cool. Any other ones that I could quickly try and go after with you guys? Cool. I think I'm gonna get booted out of here. Yeah, there's a bunch more stuff in there, so like hopefully it answers your questions. If not, like I'd be more than happy to have a consult with you guys if there's anything specific you guys would want to address. So,
Sorry, maybe not secretly. I recorded the whole thing, so there was a lot that Shawn covered. So I talked to Kate about figuring out a way. I'm probably going to upload this to YouTube and unlisted, and I'll share it with Kate to get it to you guys. Or if there's any questions, I'll make sure Kate has mine and Shawn's info. So if you do have specific questions, you guys have a way to reach out to us. Also, Shawn's cards are here, my cards are here. So if there are any questions along those lines, or need us to cover anything else, like we can kind of work a way to figure out how to help you guys out and we can.
cool. Well, hopefully you guys learned something. Thank you. Yeah.